Betty Murray, Certified Nutritionist and Education Director for the Gluten Intolerance Group of Greater Dallas. And today I want to talk a little bit about how do you find out if you have celiac disease. Specifically, how do we test for all of the different things that may be appearing related to gluten intolerance and celiac. So first off, the gold standard today for a diagnosis of celiac disease is considered a positive biopsy of small intestinal tissues. So first off, it's a highly invasive test, number one, and I would have to say, in my experience working with lots and lots of gluten intolerant people and also being a member of the gluten intolerance group, is that the world is littered with people who had a negative biopsy only to have one years later, after continued symptoms, to be positive later on. The average person with celiac disease that gets diagnosed has gone through 7 to 10 physicians and has had symptoms for over 7 years. So the gold standard is a biopsy. So they send a tube down the throat into the small intestines, and what they're doing is they're grabbing tissue from different locations, hopefully, and identifying on the tissue whether the lining that should look like shag carpet, so it should stand up and have lots of shags or lots of little ridges in it, whether that shag carpet has become Berber, so completely flat. What's interesting is if you have partial destruction, you may not earn the moniker of celiac disease. So having some damage but not complete destruction doesn't earn celiac as a diagnosis. So lots of people will go away and be told you can eat gluten because your endoscope was negative, so therefore you don't have celiac disease. But they may have the starting stages of destruction. So first off, the intestines are the size of a tennis field if you were to lay them out flat, just the small intestines. And the damage that happens from eating gluten does not happen perfectly across all of that surface. There's folds and it's crammed up together, and the damage may not all happen the same in the same places. So you can have damage that takes time to show up. So even though the gold standard for celiac disease is the biopsy, there are other ways to determine if gluten is causing a problem. So the first one would be just a basic IgG, IgA food sensitivity test. Now most of the time the IgG test can be done with other foods in a blood test. Not the kind of allergy test maybe you've had done at an allergist where they put little squares on your body and they stick you with something and rub it in and see if a big welt shows up. That's called a RAST test. That's a little bit different. This is actually a blood test looking for immune reactivity to the actual protein component of the food. And that is readily available from several different labs across the United States. You might want to look for a functional medicine doctor or a functional nutritionist that works with a functional medicine doctor to help you find those. Now, that food allergy testing will often identify if the immune system is responding as a sensitivity to the gluten protein. So when we first find that, we know at least there's an immune response. So we've got an positive IgG antibody response to gluten. The next thing to look at is to see if there is an IgA antibody response to gluten, which is the mucosal area of the body, also an antibody response. That is one of the primary responders to anything the body sees as foreign. So if we have another test that looks at the IgA response, and often that's found in saliva, it can be found in blood, or it can also be found in stool testing. So that IgA response, if that's positive, that's another positive for gluten reactivity. What's interesting about the IgA in particular is it is tied to another marker called secretory IgA, or total IgA. So IgA stands for immunoglobulin A, and what's interesting is about 30% of the human population is what we call a low secretor of secretory IgA, or your total IgA. So what that means is those people don't produce very much IgA antibodies, period, to anything. So that IgA gliadin antibody may or may not be elevated, and if they happen to have a suppression of total IgA or secretory IgA, they may be falsely negative. So for example, if I happen to have low secretion of IgA antibodies, so I'm very, very low, I'm depressed, secretion, and I produce a normal amount of gliadin antibodies, or even a low amount, that may be a false negative because I don't produce much of that antibody anyway. So if you watched my video earlier about how to tell between the different things of an allergy and a sensitivity, so if you haven't watched that, I recommend going back to bring that analogy back in. It's as if you only sent 5 guys from the army to occupy an entire country. Okay? You just don't have enough of that antibody response resources to actually bridge a response to for the immune system against that particular antigen, in this case gluten. Okay, so if we have a positive IgG or a positive IgA, regardless of positive or negative secretory IgA either being high or low, that now indicates the immune system is seriously responding to gluten. Okay? The next thing that you can look at from an antibody activity are 2 other blood markers called endomysial antibodies and tissue transglutaminase. Don't have to remember what those are, but they're 2 blood markers that will show antibody and immune system reactivity to actual tissues. Endomysial tissue is what you have in your small intestines, and then tissue transglutaminase is actually in multiple parts of the body, but it can also show up there as an antigen activity. If you're positive on those 2 as well, and either the IgG alone or IgA alone or both of those together, that would then earn you the opportunity to get an endoscope to look further. So if you step back a little bit, what's interesting is the Lancet several years ago said that the removal of gluten from the diet and seeing a remission of symptoms is enough to earn taking it out of the diet. So if you've had an endoscope and it was negative, or maybe you've had blood tests and they were negative, or maybe you've had all of those different tests come back and they were inconclusive, maybe you were in the range but elevated but didn't get out of range, here's my personal recommendation. If you take gluten out of your diet and you feel better, it's worthy of taking it out of your diet, period. If this was any other food, let's say sugar for example, and you had a massive symptom change by taking sugar out of the diet, there would not be an outcry from anybody about how that was impossible or inappropriate to do. So think of it this way. If you take gluten out of your diet and you see that all your symptoms go away, or a vast majority of symptoms go away, it's well enough right there to take it out. We don't know today. We don't have absolute easy to diagnose blood tests or other kind of tests to absolutely say hands down without something invasive that there is an immune response to gluten that is causing damage in the intestines. We can't tell the gradation between start of the disease to complete destruction. And there's a lot of things that happen in between, and it doesn't really matter whether you have celiac disease or gluten intolerance. Either way, it's inappropriate immune response to the body tissues and to a food that ultimately leads to additional immune dysregulation and a faster and earlier likelihood of early death from multiple types of other conditions. So gluten in itself, if you're reactive, needs to be removed even if you don't have 100% positive tests across the board. That's my own personal opinion. I definitely have other people that agree with me in the medical community, but I wanted to give my 2 cents worth. I've met lots and lots of people in my practice that have removed it, felt better, had tests done, told they could eat it, went back to eating it, and were very conflicted on whether that was the best thing to do. There's nothing in gluten, gliadin, wheat, barley, rye, spelt, trical that is required by the human body that you cannot get somewhere else. So if you find that removing those foods make you feel better, just do it. I thank you for listening today. Have a healthy and happy day.